A 40-year-old male undergone a laparoscopic cholecystectomy post-operatively. He is very anxious and having severe pain. After reviewing the drug chart, we found he only got Panadol. Now he is tachycardic.
So, define pain.
Pain is unpleasant sensory and emotional that lead to patient discomfort. I can't remember all of it.
Okay, unpleasant sensory and emotional experience associated with actual or potential tissue damage. Correct. Now,
So,
if you saw this drug chart, okay, what would you tell the nurse, and what will you do?
I will ask her if he got his all doses, and I think I will manage the patient according to CRISPR protocol, and maybe change the energies.
Okay, you will give the omitted dose. Correct. If the dose was missed, you will give the omitted dose. Correct.
Yes,
And you
yes,
will
and
watch
do
for the
accident.
patient response. Correct. If no improvement after
Yes,
paracetamol, then you may give him like morphine, and then you will investigate that what is the reason behind this, why the analgesic was not given. Okay, you will mention the clear instructions, and you will do for file incident report,
incident report.
because this is a medical malpractice incident. So now, tell me about the uh, whole management of this patient.
Well, don't follow breathing and check the circulation. Patient cardiac maybe due to pain, and we'll check if there is and then check of level of disability and the level of conscious. Then we will go for assessment of the patient chart and full history and examination of the patient,
Okay.
and then we'll decide the management plan.
Okay.
If the energetic is adequate for the patient, we will continue and review. If inadequate, we will check if there is any complication or incorrect impediment of the analgesic.
Okay, we'll come back to this answer as well. Okay, there are a few things that I would like to
Okay.
add. Yeah. Okay. So tell me the side effects of opioids.
Side effect of use, first to have meiosis or pinpoint to pupil, and respiratory depression, and constipation, and aspiration, and hypotension.
Okay, all right. So there are a few things that I would like to add in this one as well. Now, tell me what is the pain pathway?
Let's start with nociceptor or free nerve ending, and then afferent is the C fiber for slow pain, and the adult fiber for fast pain. It will ascend in the pathway in the lateral spinothalamic tract, and then to the thalamus and cortex.
Okay,
And it also receive from the limbic system, which is responsible for emotional response with pain.
all right. So what are the pain scoring system?
We have a multiple scoring system like numerical or verbal, or numerical, verbal, and visual analog.
And the functional assessment and the Wong-Baker phases for children, correct?
Function and what?
Wong-Baker phases, okay.
Okay.
Wong-Baker is for mainly for children, okay. Now, how is the sensation? Okay, this is not coming. What is patient control analgesia?
It's a pump mechanism to control the patient pain, formed mainly of opioid, and maybe have steroidal and non-steroidal and paracetamol.
Okay, all right. So, what is the normal dose of morphine? 0.5.
Can I come back
Okay.
that question later?
Okay, no problem. Just remember, Brother Muhammad,
Mm.
0.5 to 2 mg is morphine dose in PCA. Okay, passion control analgesia. This is the dose of morphine, 0.5 to 2 mg. The naloxone dose is
Okay.
0.4 to 2 mg. All right, it's the antidote of morphine. Remember the naloxone and
Okay.
yeah. So, what are the problems related to
Yes.
passion control analgesia?
Patient should be oriented as they have to press the button for pain and may cause sleep disturbance, limit patient mobility, and may break down or run out of button.
Okay, very good. Now, tell me the complications of pain.
So pain, we have it's for CVS, we have increased the heart rate and the blood pressure, may cause myocardial infarction, and for respiratory might cause chest movement and food activities. For rotate, decrease the gut motility, and for the musculoskeletal, it increase the mobility may lead to DVT and pulmonary embolism.
Okay, so you respiratory, you mentioned the limit, the chest movement leading to atelectasis, retained secretion, and pneumonia. Correct. All right. So,
Yes.
can you give me the examples of opioids that we are commonly used, and which agents are synthetic and which ones are non-synthetic?
Can I come back that question later? I remember some, but I don't know what's synthetic
Okay, no, no
and
problem, no problem. Why is codeine bad?
I don't know. Can I come back that
Okay,
question later?
okay, no problem. What is the mechanism of action of paracetamol?
Yes.
Okay,
It
okay, no problem, Brother Muhammad. Okay, so
okay.
we have these questions that we would like to go for again. The first question, listen very carefully, Brother Muhammad. Okay, I will discuss a new
Okay.
question as well. For the, for the pain pathway, okay, what is the pain pathway?
Mm.
Simply, you mentioned this, the pain is transmitted via the A delta fibers and the slow C fibers, correct?
Yes.
To the lateral spinothalamic tract, then to the thalamus. So, first we have the first order neuron, which will take the stimulus from the peripheral nociceptor. The peripheral nociceptor will convert the pain stimulus into electrical signals, and through the first order
Right.
neuron, it will reach to the dorsal root ganglion, correct?
Correct.
Then the
Yes,
second order neuron will go from the dorsal root ganglion to the thalamus. Then the third order neuron will go from the thalamus to the cortex.
yes.
Just remember this pain
Okay.
pathway, okay?
Okay.
For the what are the pain scoring system? Mention the whole name like verbal rating scale, numerical rating scale, visual analog scale, and functional assessment. Okay. Now this question is for Dr. Prabhat and Dr. Sultana.
Okay,
Okay,
sir.
this is a new question.
Yes.
In scoring system, what is the time interval to repeat the tests?
Hmm. Can we guess?
Yeah, in scoring system, what is the time interval to repeat the test?
Maybe 10 minutes
It is
or 30.
15 to 30 minutes. Remember, okay?
Okay.
Okay. So the next question that we ask about pressure control analgesia, you have to remember the definition. It is a syringe pump connected IV to allow the patient to self-administer the boluses of morphine. Okay. A lockout time is set within which pressing the button again will not result in the bolus of analgesia.
But
A one-way valve prevents the backflow of opioids into the infusion chamber, which may lead to overdose when re-delivered. All right. So now, what are the benefits of the patient control analgesia?
For this is the better patient satisfaction, better analgesic, less side effects, and less need the staff and nurse.
Okay, very good. So faster pain sensation to pain relief time. Okay, faster pain sensation to pain relief time, hence better control of pain. Objective measure like how much analgesia is required, the dose adjusted from the patient to another patient. Okay, like it is according to the need. Also, reduce the nursing input and medication errors. These are the benefits. Okay, so these are the new questions that I'm discussing now. What other option if opioids are not enough?
Opioid not enough,
Epidural
then
analgesic.
interventional therapy, nerve block,
Yeah, so we have the patient
uh,
management, okay, pain management
can give,
team,
or
epidural or regional block. Remember
epidural
this, okay?
anesthesia.
Now, what other modalities of
Okay.
analgesia are there beside passion control analgesia? Yeah, Dr. Prabhat, can you hear me?
No, sir, I don't know.
Okay, so we have the patient control analgesia. Beside this, we have epidural or local regional block, correct?
Yes.
Correction.
Yeah. Where would
Yeah,
you
these.
manage this
Okay.
patient in the HDU? Okay. What medication is used in the patient control analgesia?
Morphine,
Morphine.
Yeah, morphine,
diamorphine.
pethidine, okay, fentanyl, ketamine, okay, and SEDS, paracetamol. You can use these things. All right. So we discussed the whole station. One question is left, which is the how will you manage this patient? Now, I want you to go with me, okay? Dr. Prabhat and Dr. Sultana, can you hear me?
Yes, so we need to
Yes,
explain all the steps of ABCD, right?
Yeah, go ahead. Tell me everything.
Okay, so first of all, I would like to manage this patient according to the care of critical ill surgical patient protocol following the ABCD approach. In airway, I'd like to check the patency of the airway by talking with the patient. And if the patient is talking, then the airway will be patent. And after that, checking the saturation. If it is low, then I would like to administer high flow oxygen 100% via the non-rebreather mask. And check the breathing respiratory rate if the chest movement is equal or not, and listen to the chest if there is any added sound or not. Then I will, for circulation, I will check the pulse and the BP of the patient and capillary refill time. And I will also like to open two wide bore cannula, and from one I will draw the blood and send the investigations like hemoglobin, urea, and electrolytes, CRP, liver function test, blood grouping, and cross matching. And from another one, I would like to administer fluid as per needed. And also, I would like to monitor the fluid with urine output and monitor the cardiac index, which is pulse rate, blood pressure. And also, I would like to do AVG. And for checking of the consciousness or alertness, I will check if the patient is alert or not. If he is not alert, then I will stimulate the patient with pain, verbal stimulation. If he is not respondent, I will mark as a non-respondent, and I will excuse the patient for any catheter, any dressing, any discharge. I will look for them. And after that, I will review the patient charts if the medication is uh, correctly prescribed or not, correctly given or not, or if the medication is correct for that patient or not. Then I will follow all those investigation and manage accordingly.
Okay. So for this pain management, okay, here you will mention first. I'll treat the patient according to the care of critically ill surgical patient protocol. First, the airway, breathing, circulation, disability, and exposure. I will do the full assessment of the patient. I will review the chart of the patient, okay? And I will ask whether the analgesic was given or not. Was it effective or not? And was it appropriate or not? Then, if the patient
Yes.
is hypotensive, I will give the patient 20 ml per kg of crystalloid normal saline. Then I will go and take a history of the patient by Socrates. and then I'll go for the systemic examination. I'll do the arterial blood gases level, chest X-ray, ECG, and then I'll decide and plan. If the patient is improved, I'll continue with the treatment. If not, then I'll involve multidisciplinary team approach, including the acute pain services, my consultant, anesthesia team, pharmacist,
Yes.
and nursing staff. This will be your answer, okay? Be very, very specific. If he will ask you what you
Okay.
will do
So
for the airway, then you mention about, the CRIS protocol. For the airway, I'll do this. For the breathing, I'll do
okay.
this.
So for the first question, like how will you manage the patient after this drug chart? We we need not to explain all those A, B, C, D, E.
Yes, you will be specific. After seeing this chart, what you
Okay.
will do, I will ask whether the analgesic was given or not. If not given, why it's not given. I will give the omit dose of the analgesic. And I'll do the file
Okay.
incident report
Then
because this is a malpractice. Okay. The first question they are asking
okay.
about
So
malpractice, that what we will be doing. So the important thing here to give the omit dose and give the clear instruction to the nurse staff and file the incident report. Okay. So this was all about the pain
so
management. I think we covered the most of the questions. Uh,
Sir, excuse me. So, what will be the answer? Like, what will be the full passage assessment? If they ask like this, then only we we say we I want to do ABCD and patient charts review, and then investigate and then plan accordingly. Like plan if he is if he's
yes, yes,
tolerating,
yes,
then
yes.
continue
Look,
same
if
treatment.
they
If he's
ask you,
not tolerating, then multidisciplinary pain.
yes, 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 the
Okay.
question will be different. Okay, what will you do after seeing this chart? What is your management? Okay, after seeing this chart,
Uh-huh.
it's a common sense. You will give the omit
What will
dose,
you do?
okay, and you will do the, you will give him the omit dose. Then you will give a clear instructions to the staff nurse, okay. You will investigate why the analgesic is not given, and you will go for the file incident report. Remember this. Now
Yeah.
we covered
But
most of the
what if
things.
the like
Yeah, yeah.
so if what if the analgesic is was not prescribed like in the first place? So we should
Yeah,
first check if it is prescribed or not, right?
exactly, exactly. Okay. So just that's why I'm telling
Okay.
you
Then we can
very
understand.
clearly, okay, listen to the examiner, what he's saying. Okay, first
Okay.
understand the question. When you understand the
Mm.
question, only then, because in SCCA, the scenario might be goes in different way, like not according to the notes, okay. So the scenario, the answer
Yeah.
will be within the scenario. He might ask you something which will be in the scenario, okay. So if he asks you something which you don't know, just look to the scenario, okay,
Mm-hmm.
and you can easily pick up the answer from the scenario. Believe me, if you understood the scenario, if you understand the question, it will be easier. SCCA is something like, common sense. It's a concept, and usually the question repeated as it is. But the examiner might, change the sequence of the question. So
Yes.
this was about the SCCA. I think we covered, except the side effects of opioids, which include the respiratory depression. Okay, the examiner wants the whole systemic side effects of the steroids. So in the systemic, it causes respiratory depression. Okay, cardiovascular, it may lead to hypotension. In the CNS, it may lead to confusion, delirium, seizure. Okay, in the GIT, it may lead to nausea, vomiting, and constipation. It may lead to tolerance, dependency, abuse, addiction. Remember the side effects. All right, we covered most of the pain management.